Hello there. Welcome to the Learning.podcast, your space to learn, grow, and connect. Let's dive in.
Hello and welcome to the 𝑬𝒓𝒊𝒔𝒕 Health Education Podcast, brought to you by Learning. Each episode brings simple, practical guidance to support healthy mothers, healthy babies, and strong families.
Welcome back to the Deep Dive. Today we are taking on a topic that is, well, it's foundational, incredibly sensitive, and really defined by a race against the clock.
It is.
First trimester care. We're focusing on those initial, critical 0 to 12 weeks of pregnancy.
And our mission for you, our listener, isn't just to skim public health advice.
Right.
It's to really get the why behind every single instruction. The biological reason, some things are mandatory and others have to be avoided.
I found the sources almost breathless. They just kept emphasizing the speed of it all. It feels like every single day counts.
You've put your finger on it. That's the central tension. This is the window where organogenesis happens.
Organogenesis?
Yeah, the baby's entire operating system, the brain, the spinal cord, the heart.
All of it.
All of it. The major organ systems, they all begin to form specifically within these first 12 weeks. If you miss an intervention now, you might miss the only chance to prevent a major complication.
So it really does set the foundation for everything that follows.
For the next 9 months and really for the rest of their life.
Okay, let's unpack this. If development is happening at lightning speed, where does the urgency actually begin? What are those immediate steps that just cannot wait?
Well, the urgency begins with the acknowledgement of the pregnancy itself.
So the first pillar of care, and this is the absolute top priority according to the guidelines.
It is.
Early antenatal care, or ANC. The guidance says you must start it as soon as a period is missed or a pregnancy is confirmed.
And here's where we really do the deep dive. Why so immediate? It's twofold. First, you're establishing baselines for the mother, blood pressure, existing conditions.
All the basics.
Right. But second, and this is critical, is the screening for infections that pose a massive risk for vertical transmission right now.
Which infections are we talking about?
We're talking about HIV, syphilis, hepatitis B, and usually checking for rubella immunity status.
Oh.
And the early screening is just so crucial because if the mother tests positive for, say, HIV or syphilis, starting treatment immediately, it drastically reduces the risk of passing it to the fetus.
So if you wait until the second trimester?
You've lost valuable time. You've missed a critical window during that organ-forming stage. This first ANC visit is a lifesaver, not just a confirmation appointment.
That completely reframes its purpose.
Yeah.
Okay, moving to the second non-negotiable step. This is essentially preventative medicine in tablet form.
Folic acid.
Folic acid, the sources mandate taking it, or an iron folic acid combo every single day.
And this is one of the most powerful, time-sensitive things you can do. Folic acid is specifically to prevent neural tube defects.
Like spina bifida.
Exactly, spina bifida, anencephaly defects of the brain and spine. But here's the crucial insight. The neural tube closes by the 6th week of pregnancy.
6 weeks. That is incredibly early.
It's so early, often before a woman even realizes she's pregnant. Precisely. That's why starting folic acid before you even conceive is ideal, but the moment you know, it's mandatory. That window is already closing fast.
Okay, so shifting gears a bit, let's talk about sustaining the body through this incredibly demanding phase. Pillar 3, nutrition and hydration.
Right. And this is tough because the first trimester is famous for morning sickness.
Which makes following any advice feel impossible.
It's a real battle. That surge in pregnancy hormones, HCG and estrogen, is what triggers it.
So what does the guidance say?
The guidance is clear. Maintain a highly nutritious, diverse diet. Vegetables, fruits, quality proteins like eggs, fish, meat.
But how do you actually do that when you feel sick?
The behavioral advice is key. Eat small, frequent meals.
So you never let your stomach get completely empty.
Or completely full. It helps regulate blood sugar and minimizes acid reflux, which just makes the nausea worse.
And hydration. That must get overlooked a lot when you're nauseous.
And it's so dangerous to overlook it. Dehydration can lead to really severe issues. It can throw off your electrolyte balance.
I imagine in extreme cases it could even be worse.
Oh, absolutely. It can trigger contractions or require hospitalization for IV fluids. The sources are clear. Drink plenty of clean, safe water. It's the simplest intervention with massive protective value.
The body is dedicating huge resources, which brings us to pillar 4, rest.
The body is building a whole new organ, the placenta, while increasing blood volume and producing hormones. It's exhaustive work.
So what's the official word on recovery time?
A minimum of 8 hours of quality sleep nightly. And we don't just mean getting into bed, we mean restful, dedicated sleep.
And during the day?
The sources advise short restorative rests. You have to listen to your body. Fatigue isn't a moral failing. It's a sign that your body is prioritizing the baby.
And finally, rounding out the essentials, pillar 5, hygiene.
Simple but vital.
It seems obvious, washing hands and so on, but what's the deeper level here?
We need to get specific about certain pathogens that are teratogenic.
Meaning they can actually damage the fetus.
Yes. The two major ones we connect to hygiene in this trimester are toxoplasmosis and cytomegalovirus, or CMV.
Toxoplasmosis is the one people associate with cat litter, right?
Exactly. Handling cat litter, or even just gardening without gloves, can be a source of the parasite. If you get it early in pregnancy, it can cause severe fetal brain damage.
And the other one? CMV.
It's very common in toddlers, spread through saliva or urine. So if you have older kids, you have to be so diligent about hand washing after changing diapers or handling their utensils. It's about targeted hygiene against specific dangerous pathogens.
Okay, so this is where it gets really interesting. We've covered the essential DOs. Now we pivot to the critical don'ts, the things that risk interrupting that delicate organ formation.
This is all about creating a safe, non-toxic environment for the baby to grow.
First on the list, and it's stated unequivocally, do not smoke or drink alcohol. This seems obvious, but what are the specific consequences in the 0 to 12-week window?
They're tragically specific. Alcohol can lead to fetal alcohol syndrome, which affects facial features, growth, and causes severe neurological issues.
And smoking.
Smoking introduces carbon monoxide, which constricts blood vessels. It severely reduces the oxygen and nutrients the baby needs for that rapid growth. It massively increases the risk of miscarriage. There is no safe level.
None.
Not for either substance.
And related to that, the rule on medication is just as strict. Do not take any medication without consulting a health worker first.
This is a point that often catches people out. They assume a common pain reliever is fine or an herbal supplement.
Yeah, you think, what's the harm?
But many drugs are known teratogens, and their effect is most damaging right now during organogenesis. Every single pill has to be vetted by a doctor.
And let's just reiterate the food safety rules.
Yes, avoid raw or undercooked foods, unpasteurized milk, certain soft cheeses. This is all about minimizing exposure to listeria.
And listeria in early pregnancy is?
It's highly dangerous. It often leads to miscarriage, stillbirth, or severe infection in the fetus. Your food has to be thoroughly cooked and safe.
So we've covered substances and food. What about physical activity and environmental hazards?
There are 3 key physical stressors to avoid.
Yeah.
1, avoid lifting heavy objects. 2, avoid long travel, especially on rough roads. The vibrations and stress are just an unnecessary risk. And 3, avoid exposure to chemicals.
Not just industrial ones, right?
No, even household cleaners, strong fumes, pesticides, you need good ventilation, or better yet, just delegate those tasks entirely.
Now, we have to distinguish between those serious DOTs and the common symptoms that are just, well, they're part of the first trimester package. What's normal?
Nausea, manageable vomiting, feeling overwhelmingly tired.
Mood swings.
Huge mood swings, yeah, from the hormones. And mild intermittent cramps. These are typically normal. They're bothersome, but they don't incapacitate you.
But the danger signs, these are medical emergencies. This is when you stop everything and go straight to the nearest health facility. We need to be crystal clear on these.
Absolutely. When in doubt, you go. Do not delay.
Okay, what's first on the list?
First, severe, debilitating abdominal pain. Second, heavy bleeding or passing clots.
Okay.
Third, fainting or persistent dizziness. Fourth, a high fever. Fifth, severe vomiting, the kind that prevents you from keeping any food or liquid down.
Any others?
Yes. Bad-smelling vaginal discharge. And finally, painful urination, which could mean a serious infection.
Let's focus on that first one. Severe abdominal pain. What is the biggest potential threat there?
If we connect this to the bigger picture, severe abdominal pain, especially if it's mainly on one side, is the classic red flag for an ectopic pregnancy.
For our listener, can you just briefly explain what that is and why it's so urgent?
An ectopic pregnancy is when the fertilized egg implants outside the uterus, usually in a fallopian tube. As it grows, it can rupture the tube,
Which would cause?
massive internal bleeding. It is a life-threatening emergency for the mother if it's not treated immediately. And since this almost always happens in the first 12 weeks, that severe localized pain requires immediate intervention.
It's a medical race to save the mother's life.
It is. And that's why the guidance is so emphatic. Early action saves lives.
We often focus just on the pregnant mother, but the guidance also talks a lot about her support network.
The family and partner have to transition into being active protectors of the pregnancy.
So what does that look like specifically?
It's three cannibal things. First is practical, reducing the mother's workload, taking over physically demanding household work, fetching water, carrying groceries, heavy cleaning.
Which helps make that 8 hours of rest actually happen. What are the other two?
Second is emotional support. You have to provide reassurance, patience. The hormones are causing huge mood swings and anxiety. And third is guaranteeing access to quality food, making sure those small, nutritious meals are always available.
So this isn't just about being kind. It's physiological, right?
Yeah.
How does a lack of support directly impact the fetus at this stage?
A lack of support creates chronic maternal stress. High stress means high cortisol levels. Those stress hormones flood the mother's system, and the sources show that can negatively impact the foundational development of the baby's brain.
So a supportive environment is a biochemical necessity.
It is, not a luxury. Family members are literally helping manage the chemical environment of fetal development by providing rest and calm.
This deep dive has given us a remarkably clear blueprint. So to recap for you, the listener, early ANC is essential. Daily folic acid is non-negotiable. You have to maintain safe habits, no smoking, no alcohol, strict food safety, and you must be acutely vigilant of those danger signs. These are the pillars.
They are. And as we close, let's leave you with a thought that connects this biological urgency with community awareness. We established that the brain, spinal cord, and heart all form within these first 12 weeks.
All right.
This means intervention has to start before a pregnancy is socially visible or sometimes even widely known. Given this hidden timeline, how does the guidance challenge all of us, communities, healthcare systems, to be proactive, to support mothers who are often struggling in silence, ensuring they get the time-sensitive care they need, even when the pregnancy is invisible?
That idea, supporting the invisible phase of development, is a powerful challenge to mull over. Use this critical knowledge, apply this understanding, and be well-informed. We'll see you next time for the next deep dive.
Thank you for listening to the MNCH Health Education Podcast by 𝑭𝒊𝒓𝒔𝒕. Stay informed, stay healthy, and join us again for the next episode in the series.